So ear ringing is actually one of those symptoms that kind of tends to get thrown away quite a bit. Um, but I don't look at it that way. I think it's actually really important. The pitch matters, which ear, how often, how loud, all those things matter. But one of the things that's really important, that's kind of like an in for people that have orthostatic intolerance, and I'm including like POTS, orthostatic hypotension, all of like this whole group of symptoms, is that in people that have a hard time draining the internal jugular vein, and that could be because something that's happening in the neck or in the skull, or even actually in like your upper arm and shoulder, that blood flow can back up through your neck, kind of like a toilet that's backing up. It's not draining. And it can cause that congestion into your sinus and into your ear. So some people also notice that they get congested on that side. And they'll feel in that one ear, they'll hear their heartbeat or they'll feel their pulse as their ear is ringing. And what's wild is you can take, a lot of times these aren't super complicated to be able to figure out or to work with, because a lot of times it's just simple things like offloading that musculature or changing the postural structure in the neck. And you can see it happen right there, where it's like the ear will start to click, it'll start to drain, and it'll go away, and people laugh and it's fun. But it's a big deal because it takes that pressure out of the head, allows the kind of think more clearly, the brain fog clears up a little bit. And it's a way that, without having to do things that are risky, without having to do things that mess with other systems, with other chemistry, just taking care of that hygiene of your neck and the tension of the muscles, the position of the bones, can be like a huge, huge benefit that comes with very little risk, super high reward.